Morning, everyone. I think I can see almost all of you on my laptop, and I've turned off my big screen so I'm not sort of looking at one thing and speaking on another. I'm Susan Heegard. I'm the president of the Midwestern Higher Education Compact, and I'm very, very pleased to be with you today. I'd rather be in Omaha. That is where we were supposed to have our executive committee meeting, and so I'm not even going to say this is almost like being there, because it isn't, but it's good nonetheless. And so we're going to have a session before our executive committee meeting. We're holding that meeting from 10 to 12 today, Central Time. But before that, we wanted to try to find a speaker that would reflect both the state and the times that we're in. And I can't think of two better individuals than President Carter, who heads up the University of Nebraska System, and Chancellor Dr. Jeff Gold. But I'm not going to provide details about them. Susan Fritz is going to do that. So Dr. Susan Fritz is one of our Met commissioners, and I'll introduce her in just a moment. But first, I want to make sure that I'm paying attention here and following through on the rules that we need to follow, since this is not an unruly crowd, but it's a large group. We will be, I believe, there's a chat function here. So if you would like to raise your hand or you would like to speak, you need to note that on the sidebar, and then I will recognize the speaker. I think that's the plan. And then, no?
If we can keep all the questions in the chat, and then Susan, you'll moderate.
Yes.
The question.
Right, so I'll moderate. So I'll ask the question in the chat, and then we can have a conversation. First, President Carter will speak. We'll have a short period of time for some questions specific to his presentation. And then Dr. Gold will follow, and then we'll have questions that follow for both of the speakers. Is that what you wanted me to cover, Katie and Mary? Great. All right, with that, I would like to introduce one of our Midwestern Higher Education Compact commissioners, Dr. Susan Fritz, a Nebraska native. I think I have that correct, yes. Susan. Yep. Susan is the Executive Vice President and Provost and the Dean of the Graduate College at the University of Nebraska. Is that correct, Susan? Or
yes, it is.
Over time, you've had a number of titles, but I think that one is current. Before joining the Provost office, Susan served as the Associate Vice Chancellor for the Institute of Agriculture and Natural Resources and the Interim Dean of the Agricultural Research Division. And my understanding, Susan, in talking with you when we've met before, is that you actually you're living the dream, because you actually come from an agricultural background.
Absolutely.
That's right, and you still do. You're a 1979 graduate of the University of Nebraska Lincoln, and you received your master's and PhD also in the state. So with that, I wanted to introduce Dr. Susan Fritz, who will introduce our wonderful guest today.
Well, thank you, Susan. I appreciate that introduction, and I'm delighted to be able to introduce our two speakers this morning. But first of all, I would like to say I am sorry that we are not in Omaha and you're not in Nebraska, but hopefully we'll get you there very, very soon. Today, I'm pleased to introduce President Ted Carter. Ted became the 8th permanent president of the University of Nebraska System on January 1st, 2020, so freshly minted. Ted came to us from the U.S. Naval Academy, which is his alma mater, and where he had served as superintendent for 5 years. His successful tenure as superintendent of the Naval Academy included record-setting graduation rates and student diversity. He also brings an accomplished military record. He is a naval flight officer, a graduate of Top Gun, and has served overseas. As president of the University of Nebraska, Ted leads a 4-campus system with 51,000 students and a $2.6 billion budget. The flagship Big Ten University, a metropolitan campus, a rural residential campus, and an academic health sciences center all comprise our 4 campuses. I think Ted would agree it's an interesting time to be a new university president. It's fair to say that whatever Ted thought he would be spending his time on when he took the position has just really gone out the window. However, I will quickly say he has approached the challenges with a sense of calm and, as he would say, a bias toward action. He's cautioned us not to get lost in the fog of war, and with his military experience, he knows what it means in a very real sense. I'm excited for you to hear about Ted's leadership philosophies and what the University of Nebraska is doing to plan for the year ahead. Now I'll turn to President Ted Carter.
Wow, thank you, Susan. That was very generous. And you know, the one thing that all of you should know, and it's just such a pleasure to see so many friendly faces, some of who I have not had the pleasure of meeting yet, but I think many of you may know, but if you don't, Susan was the interim president here at the University of Nebraska for 6 months and was instrumental in the turnover process and did so seamlessly. So yes, there have been 8 presidents. I actually consider 9 because Susan did that during a critical time here. As already been mentioned, you know, I served 38 years in uniform, and I just could not be more blessed and pleased to be here at the University of Nebraska. This is a critical higher education institution, representative of all the Midwestern states that you are all part of. And what I thought I'd spend a couple minutes here is giving you my perspective over the last 6 months, a view towards higher education. I've been in the higher education field while I was in uniform. I was the president of the Naval War College and then 5 years at Annapolis, and now here. And let's face it, as we just take what I would call in the Navy a running fix, a navigational fix on where we are, we're in a place that maybe our nation has never seen ever in our history. You think about the 100-year pandemic that Jeff Gold can speak to so eloquently, and we'll talk to a little bit. And then put on top of that, you know, besides the, you know, the economic and the medical crisis that creates, this rising and trying to understand racism throughout our nation, highlighted by the killing of George Floyd. And obviously, Susan and the entire Midwestern Higher Education Compact has seen that play out right outside their office doors. But it's being felt everywhere in the nation, to include here in Lincoln and Omaha, and even the smaller communities throughout the entire Midwest. We haven't seen this type of racial tension really since the 1960s. And maybe the COVID-19 issue and what's happening are not completely disconnected. And a lot of the things that I'm going to talk about here over the next 15 minutes, and hopefully have some time for some of your questions, are not necessarily reactions to that. But I would tell you, as a leader of this higher educational institution, that I believe one of the most important aspects for our nation going forward is going to be higher education. Higher education is going to be part of the solution set for how we come through this. And we all have to be thinking about our own bias for action. I've had the opportunity to speak to many of my peers leading other higher educational institutions all across the nation. And I've seen really kind of 3 type of leadership styles going into this. There are some people that are somewhat paralyzed, hoping that this will go away and that a vaccine will save us all and we'll be just fine. There are others that are waiting for more perfect information before they make any big decisions. And then there are some that have a strong bias for action, trying to come up with solution sets for how we deal with this, understanding risk mitigation. And I feel like the team I have here with the 3 chancellors of our 4 main campuses, 2 of which are left by Dr. Jeff Gold, we've put some things into place that I wanted to be able to share with you, some of the things that we're thinking about. But the first thing I want to tell you is for everybody in higher education, we have to think about what our true North Star is. I think higher ed is going to have to change coming out of the backside of this, but our true North Star is to continue to have the trust of the American people, the trust of our constituents in whatever state we are in, and most importantly, having trust in our current and future students. So everything that we have done, every part of our focus here has been centered on affordability, accessibility, hope, predictability. And I believe we at Nebraska, like all of the institutions that you represent, we exist to create pathways for all. And if we lose sight of that, then many of us will risk becoming either less relevant or in some cases, not having enough students to even sustain ourselves and going away. But we also have to make sure that we're taking care of our people. This is part of the trust, not just our students, our faculty, our staff, and our communities. It's really important for us to demonstrate that. It's not lost on me, as Susan mentioned, over a $2.5 billion budget shared between the state and revenues for tuition and some small amount from philanthropy, that we have a $4.5 billion impact for the state of Nebraska. We're one of the largest employers with over 20,000 faculty and staff. Many of our students who are here, roughly 70 to 80% of them go into the workforce here in Nebraska, a state with relatively very low unemployment. So we are a main driver for a state that's #1 in the nation in terms of producing red meat, one of the top agricultural centers of the world. And yet University of Nebraska is a critical part to that economic solution for the state. As I said, though, higher ed is, I think, more important now than ever. We have to continue to look at the fundamental values of access, opportunity, and inclusion. So let me just tell you some of the things that we have done here. And really, these actions were being looked at as part of a 5-year strategy when I came in. Some of them we launched at certain timing based on COVID-19, and some of them even fit within the discussion at a time when we really need to be listening to all of the voices out there. We need to be ready for our students to come back to campus and be ready for those voices to be heard again. One of the big things that we launched was a thing called Nebraska Promise. This was an ability to go beyond Pell Grant, open doors for low and middle income Nebraskans, including underrepresented students. This was free tuition for all students whose family adjusted gross income was $60,000 or less, and that is actually a little bit below the household median income here in the state of Nebraska. We announced our plans to be open. We came out almost exactly at the same time as Purdue. We wanted to do that to provide a degree of predictability and also help vulnerable students that are wondering whether or not they would be brought back here to the campus safely by explaining how we were going to be ready to open. I know Jeff Gold will talk a little bit more about that. We announced a 2-year across-the-board tuition freeze. We reduced standardized tuition rates for in-state undergraduate online courses, and that matched up with what our actual in-person cost per credit hour, which probably not surprising to you, our online offerings were more expensive. We actually reduced our online cost per credit hour by 9% at Omaha and 7% at Lincoln. Just to give you an idea of the impact of those announcements, which started on April 17th, we were about 6% behind on our total number of applications for our 4 main campuses at that point compared to this exact same time last year. Since April 17th, we've had an amazing surge in applications, 21% increase to the point that we are now 8% ahead of our application numbers compared to this time last year. In fact, for our Omaha and our Kearney campus, it's the highest number of applications we've seen in the last 5 years. And since we went to a common application between Omaha, Kearney, and Lincoln, the highest number of applications since that date in 2017. But we know enrollment applications doesn't equal enrollment. That's a little bit of a guessing game. We've got to get ready for the freshman melt. Everybody right now is an enrollment officer here at the University of Nebraska to make sure that we come across the finish line. And for our fall 2020 planning, we've been guided by an incredible checklist that was developed by the University of Nebraska Medical Center, left by Dr. Jeff Gold. He'll talk a little bit more about that. We are exploring detailed options for personal protective equipment that we'll do in conjunction with the state. Obviously, we're not lost on the expense of that, testing, contact tracing. We are de-densifying our campuses. We have the benefit of a little bit of geography here in Lincoln, Omaha, and Kearney, spreading ourselves out across the dorms. And of course, we're working very closely with the governor and the legislature as the whole state opens. We did partner with the governor on a statewide survey that assessed the impacts of COVID-19 on the business community here in Nebraska. That just gives you an example of what a partner we are within the state. And of course, like all of the other large institutions, we are planning, going through many budget drills. And right now we are going into our budget announcement here on the 19th of June, where we're going to have to work through a $65 million gap in budget. And that does not include athletics. which will have its own set of challenges. Some of the immediate steps we've taken since March were to go through a hiring freeze, reduce travel, review of all of our capital projects. Every campus held back 3% of spending in the final quarter, which they all achieved, to give ourselves a little bit more cash on hand. And especially important as these cuts will be made permanently, and they won't happen overnight. They'll have to go through shared governance. We'll have to probably cash flow a little bit for ourselves here to get through the year, fiscal year 21. And as a lot of you are looking at, we are offering other opportunities, for example, furloughs. We've not ever furloughed here at the university, so not a complete loss of job, maybe a temporary. It works for some of our affiliations and our athletics, but we are going to have some pretty hard decisions ahead. We'll be making reductions in administration, even in some faculty and in some programs where we have some redundancy across our campuses. To give you an example, here at Central Administration, our main building called Varner Hall, where I am in my office today, we implemented a 10% self-imposed cut on ourselves, which we announced a couple of weeks ago, and that did cause a reduction in force of about 30 positions that saved us about $1.7 million over the next couple of years. But as we go through all this, we are not lost that this is an opportunity to get the future of education as right as we can. We're going to be a little bit leaner. We will probably go down a few in a number of students this year, but we expect that we'll be able to grow. And I am very excited for the future. I am focused on the three main questions that I think all of higher ed should be able to ask themselves and answer. What is your value? What is the cost of education for your students? What type of student debt will they leave with? What is your physical and mental health capabilities on your campus? Students care greatly about that, especially now more than ever. And finally, what is the opportunity for your students to get a job? That's what most students want to know. What do I get when I finish my educational experience? If you can answer those three questions positively, and finally, inside of that, where do you put the confidence factor in your students? Is that at the first year, second or third year? That's a hard thing to measure, but this centennial generation that's coming to our campuses, they care greatly about that. So as we think about higher ed, focused on those objectives, I think that will be our future going forward. And then, of course, as I said at the beginning, a pathway for all. So let me stop there and see if there are any immediate questions. I just thank you for the opportunity to speak for a few minutes.
Thank you, President Carter. I'm just watching the chat function. For those of you that, I'm sure you're all familiar with Zoom, but for those of you that aren't, the chat function, I believe on my screen at least, is on the bottom, and you can click on that, and in there you can type a question. And I would suggest that you type it for everyone so that everyone can see. And then I'll read the question out loud. And if you can't think of your question now, there'll be time at the end to ask that question as well. Any questions? I know I have one from anyone here. Great. Well, one of the questions I had, President Carter, for you is you talked about a surge in applications, and you touched on this a little bit, but I was curious, why did that surge occur? Were there sort of some unusual factors? Was it due to the specific programs that you talked about, the Promise, et cetera? What do you think accounted for that? Was it an aberration, or was it something that reflected the intentional efforts that you'd made to try to attract students?
Yeah, as I said, when I came here, I thought the future growth of the University of Nebraska system across our four main campuses might reside more in our out-of-state and international students. Obviously, I shifted dramatically in February and March and focused much more on Nebraskans, which across all of our campuses is about 80% of our student population, a little less so at the University of Nebraska-Lincoln, the Cornhuskers. But the Nebraska Promise was something that we were looking at, and I think that was represented a large surge, something on the order of maybe higher than 1,000 of those applications. Just to give you a sense of what 21% surge application equates to, is about 2,500 applications. So that is an underrepresented community. This is students that were kind of in between, not being qualified for economic financial aid and those that were in the Pell Grant. We had a previous program called College Brown, Nebraska. So we expected that to show about a 25% in that population. I think we've seen that and then some. The reduction in online courseware, I think also was a big attractor. At the UNO campus, Jeff can talk to this a little bit. He's seen a significant surge in online applications. And I think online is going to be with us to stay, but I remind everybody it's a vehicle, it's not the answer. There'll probably be a higher percentage of students that attend in-person classes that will take some portion of online, more than we've probably ever seen before, going from roughly 30% across the nation, maybe to as high as 75%, just because they will become accustomed to that. And I think that the predictability of declaring that we would be open, we heard from Nebraskans, roughly 80% said that they wouldn't come back to college if we were online only. And that wasn't the determinant to whether or not we'd be open, but it was something that we heard from our students, and nationwide that number is roughly 75%. And then you've also heard that 1 in 6 students are thinking about a gap year. We wanted to make sure that we were not part of that statistic, and I don't think we will be. Nebraskans are not prone to take gap years very often, but we want to make sure they had other alternatives. And as I talked to my state college system, which we have 3 relatively small campuses within the state system, and then our community college system, their application rates seem to be flat or even a little bit down. So within Nebraska, I suspect that we have taken some of their applications and they've looked to us now as a solution. And that, again, affords this accessibility, affordability, a pathway for others, especially those underrepresented communities. I also think, and I didn't talk about this, we did a significant review of our academic calendar. Dr. Susan Fritz led that effort, and we've made some adjustments for the fall, and some of you have seen that nationwide. We're going to be starting a little bit earlier, but just only online at the Lincoln campus, but we'll have in-person teaching done by Thanksgiving, and then there'll be alternative methods for how final exams will be proctored. And again, that's all towards an eye with students. And again, if you were to take a look at the academic calendar for all colleges and even K-12, many of those were built around the farming community going back over 150 years. We're all starting to rethink that. And I'm not sure that the future won't have a 4-semester style academic calendar, 2 large semesters and a large winter intersessional, and then of course a summer offering. We gave a larger number of courseware offered for the summer, and we saw a rise at Omaha and Lincoln and student credit hours. In fact, the highest we've ever seen for the summer. So again, making some adjustments focused on students, their affordability. We're looking for a pathway to create a real 3-year degree opportunity for students. We've heard that great interest in that. So again, we don't have it all figured out. We've made some pretty major shifts here in just about 6 weeks. And at least on the application numbers, there's been an obvious response.
Thank you. I have a few questions queued up here. I think one of them, I'm gonna actually mention all 3. I think the middle question, maybe we could discuss after Dr. Gold speaks, President Carter. One of the questions comes from Andy. I'm gonna read these 3 out first. Has Nebraska received or applied for the CARES Act funding? The second question comes from one of our commissioners, Suzanne Morris. She has a grandson returning to the University of Nebraska and is concerned about the university's ability, and this would probably apply across the country and in our region also, to respond to the surge in COVID cases on campus. So let's hold on that one until Dr. Gold speaks. And then Teresa Lubbers in Indiana asks, are you concerned about budget cuts that could impact the Nebraska Promise or other financial aid? I know Indiana has a robust program as well. Is this a first or last dollar program? So let's, we've got about 5 minutes, a little under 5 minutes here before to keep ourselves on time. And I know as a military guy, you're great at that. But it's the CARES Act funding, and then to Teresa Lubbers' question about the budget cuts and how you're hearing or thinking about that. Thanks.
So we received CARES Act money like all of the other higher education institutions. We didn't have to apply for that. It came to us a little over $30 million for our 4 campuses. And obviously half of that went to students, and that's already been apportioned out. Of the remaining other half, most of our college campuses are holding that in reserve to wait and see what our other budget impacts will be. To put it, succinctly, that roughly $15 million across our 4 campuses wouldn't cover our housing losses. So not a whole lot of impact there for us. And I would just say this, and I think everybody would agree, I see a few heads nodding, no matter what we get from the federal government, some we may get through the state, especially when it comes to testing, PPE, and contact tracing. It won't cover all of our expenses, and it won't be the long-term solution. We've got to think our way through this. I am very concerned about the state budget that will come to us. We think we'll be relatively flat this year because we're at the second half of a biennium budget year. So they can only do so much to us this year. But then the years going out, and I've worked closely with our governor and with key members of our very unique unicameral, one legislative body, 49 senators representing 93 counties, that I intended to put that tuition freeze on. So I've already self-imposed a cut coming from the state budget by declaring that. Most of our senators were very pleased to hear that, because when they cut from our budget, our first reaction is to raise tuition. And I've declared that we're going to do everything we can to not do that, because I don't want to pass that cost on to our students. So I am looking, as I go into the next budget cycle, to ask for an incredibly modest 2% budget increase from the state. Just to give you an idea, our state budget is roughly around $600 million, give or take some. And about 80% of all of that budget money takes care of personnel. So, and people have asked us about our foundation, and they have obviously a very healthy endowment, but we only have about 1% access to that in terms of unrestricted funding. So I'm not getting a lot of help from our foundation to offset any of these costs. Husker Athletics, it's a $150 million program. They're likely to lose between $30 and $60 million this year, and that's if we play football. So, they're going to take a pretty big hit. Right now, we do not have plans to lose any of our sports programs, but again, the final analysis of that will come into the future. So I think that's maybe a little bit of a round way answer to get to most of those questions. Susan, you're still on mute.
We're right on time, of course. Thank you. And then we can follow up. I think, Teresa, for example, if you have some follow-up that you'd like to ask, we have more time for the questions after Dr. Gold speaks. So thank you. Dr. Fritz, if you'd introduce Chancellor Dr. Gold, that would be great. Thanks.
Well, thank you, Susan. Again, it's my pleasure to introduce Chancellor Jeff Gold. Jeff has served as Chancellor of UNMC since 2014. And in 2017, he added Chancellor leadership duties at UNO to his portfolio. Under Dr. Gold's leadership, UNMC has become known as a world leader in fighting infectious diseases. And as some of you may recall, UNMC received international attention for treatment of Ebola patients during the global crisis several years ago. So when COVID-19 began to spread around the world, UNMC was uniquely positioned to respond. We have treated patients in the biocontainment unit in Omaha. Our experts are being quoted in every national news outlet. We are part of groundbreaking research in the search for a vaccine. And most recently, and as referenced by President Carter, UNMC developed an extensive checklist that we believe can serve as a playbook for the reopening of American higher education. Because of course we are all eager to resume a normal routine of life and work, but we want to do so in ways that protects the safety of our students, our faculty, and our staff, as well as the communities around us. The checklist is being used by colleagues around the state and across the country, and we are very proud to be the source of the expertise. As President Carter and Chancellor Gold call it, our next normal. By the way, a UNMC expert is also chairing a Big Ten task force that is providing guidance on resuming athletic play, and something I know of great importance and interest to all of our institutions. I'm pleased to introduce Chancellor Jeff Gold to talk more specifically about the public health considerations we're working through as we plan for reopening. Good morning, Jeff.
Good morning, and thank you so much for giving me this opportunity. Great introduction, and I'm going to try very hard to stay focused on just that, the public health aspects of what's going on. But of course, I'm very willing to take any of your questions. And so with your permission, what I'm going to do is share my screen, because I did produce a few slides. And just in case any of you are wondering, I have certainly agreed to share all of these and any additional questions or that you may have. There's plenty of contact information that will be made available to you at the end. So with that, I'm going to run through these rather quickly. In order to do this, I need to introduce something known as the UNMC Global Center for Health Security, the GCHS as we call it, which is a University of Nebraska Board of Regents established center of excellence. The name was applied to it 3 short years ago, but it actually goes back 18 years when the first biocontainment unit was constructed here at the University of Nebraska campus. And as you may or may not know, there are 14 approved biocontainment beds currently in the United States of the highest possible level, 10 of which actually are on our campus. And I won't bore you with the details of why and how that happened, but it goes back to the leadership of this community in partnership with the state going back 18 years ago. So the GCHS, as I will refer to it, is a global resource that focuses on clinical care operations, driving research and development, training and education, and indeed is all things regarding not just pandemic response, but much more than that. This is just a very short list of some of the main federal partners that we enjoy relationships with. And when I say relationships with, I'm talking about financial, contractual relationships to share expertise and judgment. We, at least historically, had people in the Beltway constantly across many states of our 5-state region. We're the leadership of Region 7 from a all-hazard response, trauma, etc. perspective. Our major relationships are with Health and Human Services, which particularly includes ASPR, the CDC, the NDMS, the National Disaster Medical System, the Biomedical Advanced Research and Development Authority, and of course the Food and Drug Administration, the Department of Defense, specifically with the Joint Chiefs, United States Strategic Command, which is our local partner, and the DHA, the Defense Health Agency, but also very extensive relationships with the Department of State and the Department of Homeland Security. It was on one of my most recent trips to Washington. I was actually having breakfast with the Secretary of Homeland Security. I'll never forget, we walked out of the room and he looked at me and he said, "Jeff, you know, if you guys can't get this right, nobody's going to get it right." And I wasn't sure whether that was a threat or a promise, but it certainly put a huge amount of responsibility on our shoulders. And the Global Center for Health Security, which we have the pleasure of hosting here on our campus, is just a remarkable organization. So as I said, that by way of introduction, the GCHS not only focuses on biological hazards, which are newly emerging, re-emerging, and deliberately emerging, and this is a map worldwide of just some of the things that we are constantly tracking, whether it's West Nile virus, whether it's multi-antimicrobial resistant organisms, Ebola virus, and by the way, in case you're not tracking, there have now been 18 confirmed deaths of a new Ebola Zaire strain in Western Africa, which we are tracking, and actually were recently asked to deploy a team to assist. We have a leadership responsibility in the WHO and in GOARN as well. But we also are an all-hazard approach to the chemical, radiologic, nuclear, and environmental hazards. So think everything from chemical spills to hurricanes, tornadoes, everything that might look like a biological agent. We're also the host of the State Public Health Lab, and indeed, as I was reminded by our governor yesterday who toured the lab with us, we are the only state public health lab that's paired to a university in the United States. And so we are interchangeably, tightly related to not only what's happening on the local level, the national level, but actually on the global level. Indeed, the GCHS team repatriated in partnership with the National Guard 51 individuals from Wuhan City in China. We deployed a team to the Diamond Princess in Japan, and we brought back all of the infected individuals to be housed in our biocontainment, quarantine, and isolation facilities. So a little bit of introduction of what the GCHS is and why it may be relevant to this discussion. I sort of like this demonstration of this very delicate and unprecedented balance caused by the coronavirus, and that is health and wellness is balanced against the social and economic factors, which include everything from our economic recovery to K-12 education, to preschools, to higher ed. And I don't know where higher ed fits in this complexity, but we look at this as this very, very delicate balance and don't see it all from the perspective of health and wellness as we work to try to make this balance more successful. So one of the things the Global Center for Health Security has done is we've pushed out a number of so-called guides. We call them mitigation and response guides. The first one is actually demonstrated here for meat processing. We've done several for the United States court system. For instance, the entire state Supreme Court bench book was developed in collaboration with the GCHS, an early childhood playbook. There's a K-12 playbook, but the one that I'm going to address is illustrated here on the left of your slide, which is called the Higher Education Pandemic Mitigation and Response Guide, which was referenced by Provost Fritz and President Carter. And what it talks about is that this guide works hand in hand and tightly connected to what the clinical environment is in the community and what's going on in the health of the community. And what I mean to say by that is that if there's not reasonable control of the extent of the virus, and we're talking, of course, about COVID-19 right now, and the clinical resources that are necessary for it, whatever happens on our campuses or around our campuses is going to be markedly inhibited and indeed almost impossible to achieve. And so what it says is that, and we'll go through some of the areas that I was asked to address in this conference this morning, is that the decision-making needs to be scientifically based. As we say, testing, and more testing, which includes genetic, antibody, and viability testing for the virus. And we can ask, and we do a lot of that testing ourselves here as a $2 billion academic medical center and extensive work. I mean, just to give you some idea of that, we actually are the institution that identified that the test kits produced by the CDC were flawed in some ways. We actually worked with the CDC over a very long weekend to correct the flaws in the test kits, which resulted directly in what are the current standards for testing across the United States. Data-driven decisions around disease control, healthcare capacity, supplies and workforce, regionally, not nationally or statewide determined decision-making, multi-staged intervals, and then, of course, eagerly waiting vaccine and antiviral availability. We do a huge amount through the Global Center and through our medical center in this area. That's not the subject of my discussion this morning, but very pleased to answer any questions that you might have on that subject. One of the things the Global Center has done, it has developed what we call the PRAM Index, which is the Pandemic Recovery and Acceleration Model. The long and the short of it is we produce this every day, not just for here in Nebraska, but it's used for 5 states across the United States right now. And it looks in a real-time way about what the health is, not only of the number of cases, tests, and deaths, but also hospital beds, ICU beds, and ventilators. And it provides to the individuals that are making real-time decisions trends. So this is a look at disease prevalence in Nebraska for the last 90 days. This is a look at hospital, ICU, and ventilator utilization in Nebraska for the last 90 days. And it not only gives you real-time numbers, but it gives you real-time trends, and which is critically important because what we do in Omaha is different than what we may do in Kearney, which is different what we may do in Western Nebraska and Scotts Bluff based upon the regional data that we have at any given time. So this is just the beginning of what's in this guide. It is broken into engineering and facility controls, administrative and campus controls, testing, personal protective equipment, residence halls and campus living, large group campus and community gatherings, experiential learning, and then co-curricular and programmatic campus activities. It talks about 3 steps. Step 1 would be less than the first 14 days. Hopefully step 2, assuming everything goes well, the next 14, and step 3 would take us up to a total of 42 days from implementation, and we've already started actively to implement this. And these materials, by the way, I will give you the links in a few minutes, but they are all publicly available. They are free to anybody that wants them, and we're very pleased to share the guide. This is what the checklist actually looks like. There are hundreds. It's actually 28 pages long. This is version 37, as Ted and I and Susan are fond of saying. We keep changing the version. And it references the various athletic conferences, and this is actually the cover of the COVID-19 pandemic playbook pushed out on June 6th in collaboration with Dr. Christopher Cradaville, and many of the other conferences are actively working with the Global Center as well, and they're all based on a very similar thematic area. But I want to talk about one or two areas that are within the guide, just to bring it to your attention. And there are these critical 5 areas of hierarchical control. So obviously, elimination of virus, anything we can do to remove the hazard or replace the hazard is going to be critical. Until that happens, through either vaccines, antivirals, or other means, engineering controls are going to be the highest priority, followed by administrative controls, and personal protective equipment are at the very bottom here. And the reason that is that personal protective equipment tragically requires individuals to have access to it, to use it appropriately, which is going to be the hardest thing to control. It's going to be a lot easier to put in engineering controls, meaning air handling, traffic flow, and things of that nature. And think about it, if we had a successful way today to eliminate the virus, it would make all of this unnecessary. And so all of the research in immunization and in antiviral agents, the way the virus is spread and things like that, which the Global Center and many other institutions are doing, are critically important. But what the guide focuses on are these 3 areas: engineering, administrative, and personal protective equipment. So this is a look at what the dashboard produces. So this is just the top of the engineering, facility controls, policy, and practice. So just to give you an example, for the 3 steps, we're currently in green mode. This happens to be from the University of Nebraska Omaha campus, is to create dedicated facility entry and exit points, several depending upon traffic patterns and the number of individuals, the primary responsibility. And this is where it's linked to our strategic plan. And as of this is a particular piece of the strategic plan, and it's currently 20% done. Second one of this section is secure all facility entry and exit points, preferably with Prox ID cards. This is the person who runs this, Charlotte Evans. It's 85% done, and this is where it links to the strategic plan. But this section, under administrative structure and coordination, Provost Fritz asked me to specifically speak to this, which is to establish an Office of Health Security with responsibility for ensuring institutional compliance, and this has been done on the UNL campus. Designate a Director of Health Security that coordinates and supports the campus health and wellness strategy development. That has actually been done. And then to establish an Office of Health Security location, a campus center, which is actively underway. So as of the first 14-day period, it's indicated in red. This will be done very soon, and hopefully by the time that we are ready to open, this will be in the green zone and will be done. There are individuals that are responsible for all of this, and this is where it links to our strategic plan. So each of our campuses here in Omaha has an individual that has been hired into these roles with this very specific position description, and both have actually started as of June 1st. Less critical on the Med Center campus because of the prevalence and the prominence of the Global Center for Health Security, but very important on our undergraduate campuses where this type of public health expertise and medical knowledge may not be as widely present. Another thing the Global Center has done in collaboration with our public health team and with our medical team is pushed out a smartphone application, which is available on both the Apple and the Android platforms. It currently enjoys no longer a 4.9 rating. It's actually gone down to 4.7. There are over 100,000 downloads of this app nationally right now, and it is not a medical tool. What it does is it provides self-screening for any individual, and it produces a recommendation. This one in the middle says you are in an urgent, or what we would call an orange category. and that you need to contact your healthcare provider. If you're in the green, you just need to practice social distancing, and it links you up to the CDC websites. We have continued to develop this, and there is going to be it's called One Check COVID, and we'll give you the links if you want to download this. Again, it is completely free. It was developed by 4 undergraduate students in the Scott Scholars Program at UNO, the physicians and public health leadership here at the Med Center, and 75 Apple engineers and programmers over 2 months ago. So this was a very, very collaborative effort, and we view this as sort of like a passport, if you think about it. And we are now in the process of electronically linking the screening status to the individual's prox cards, because all of our university facilities require proximity card access. And if you're green, you can go anywhere on campus. If you're red, maybe not. And while that's still very much a work in progress, we believe that this is going to create the kind of campus security that we're going to need. And I might point out, just to come back to what Provost Fritz and President Carter said, we surveyed our undergraduate population at UNO, and the single highest concern they have about coming back to campus is their safety, safety of their families, their parents, their grandparents, etc. It well exceeds their desire to go to athletic events, sit in a classroom, etc. They simply want to know that they're going to be safe, and hence the importance of the checklist. This is the brief list of the professional and pharmacologic interventions that we are focused on, which is everything to do with test deployment of antibodies, as well as genetic testing, surveillance of influenza-like illnesses, contact and contract tracing, reliable data securing and sharing, monitoring for secondary and tertiary rebounds, development of antivirals and vaccines, specific mitigation and response guides, which I've touched upon briefly. By the way, if you're interested in meatpacking, early childhood, or any of these others, they're all available on our websites. And let's just say we've toured, I think, 38 meatpacking facilities now across the United States. Let's just say if you've seen one, you've seen one. They're all different. And then to continue to advise federal, state, and community actions. And we've had just over $2.77 billion of implicit media that has been directly related to this. So I'm not going to bore you with these details, but these are the key community and mitigation actions that we believe are going to have to be present on all of our campuses, starting off with if you are ill or if someone in your household is ill, please stay home and self-isolate, reduce density in schools, childcare, etc., reduce contacts in the community, and trace and trace and trace. Cancel large gatherings for the moment, implement telework, use face coverings, limit large utilization of facilities, travel, workforce, and supplies, and then participate in self-screening, hopefully with some type of technology. This is the link to the website. It's unmc.edu/health security, and these are updated every single day. So you see all of the NETEC, the Nebraska Education the National Education Training Consortium, the COVID training resources, the Isolation and Quarantine Manual, which is the Bible for isolation and quarantine around the world right now, the Court System Playbook, the Child Development Playbook, the MEET Playbook, the various daily PRAM push-outs for the various states that we support, and then the higher education. And this is still entitled draft, but it will actually be pushed out formally in version 37 later this week. So with that, why don't I stop and take any questions that you might have. And I will stop sharing my screen, and I'm sure President Carter would be willing to take some as well. And I see almost within my 20-minute limit, so thank you.
Yes, you did. Thank you very, very much, Dr. Gold. So we've got about just under 10 minutes, and I wanted to just mention a couple of things. I've been tracking the Zoom chat here. We've got a couple of links that have been posted. Thank you to some folks on our staff for doing that. But all of the materials, the slides, as well as all of the links and the guides will be posted on our website. My understanding is that that'll be, where will that be on the website, Mary or Katie? Can you mention that?
I'll make it available so you can access it from the homepage.
Great,
News.
perfect, perfect. All right. So thank you. That was really, really interesting. And I'm laughing at Randy Furlek's comment. He's grateful for your decreasing his senile cynicism. We are actually working on a broad contract. As most of you know, the Midwestern Higher Education Compact, one of the things we do is try to do bulk purchasing and joint purchasing. So Jennifer Dahlquist on our staff is looking at trying to have a contract that would cut across the region for PPE and for other things, testing and things to get ready for the fall. The tracking piece, we're also looking at apps for that, and that might be in a separate contract. But I did want you all to know that we're in the early stages of trying to put that together rapidly. To Susan Morris's question, and I think this sort of takes this to the next step, which is, you know, in our membership, we have states, and so we have legislators and governors folks. We have in higher ed, we have system leaders like yourself, and also campus leaders like yourself. And so all of these folks are trying to figure out, you know, how do they prepare for what's next in the fall? I have a high school senior, you know, and he's going to be hopefully heading in person to college this fall. But how do you take the information that you've just provided, for example, Dr. Gold, and help folks think about opening on campus? And as Suzanne Morris points out, living a communal lifestyle. Thank you.
Well, you know, as President Carter likes to remind us frequently, hope is not a plan. And so hoping for the best is great. Preparing for multiple contingencies and being flexible is probably the name of the game. But we've made a very simple and declarative statement that we're going to do everything we can to safely, underscore safely, bring our students, faculty, and staff back to campus to as near normal, or as we call it, the next normal existence. And that's why this playbook, this guide, is so critical, because it goes through incredible amount of detail in each of these areas. It doesn't prescribe what to do, but it certainly lists the areas in, you know, nearly 30 pages of text, of, you know, checklists of things that one would need to consider, you know, on-campus and off-campus events, residence life, food services, you know, de-densifying the classroom, how to blend remote, we call it remote education, because we actually have 4 different categories of hybridized educational models that we are looking at for various types of things. So our aviation program can't quite be run the same way that our philosophy program can be run. And our philosophy program can't be run the same way our biochemistry program can be run, and on and on. And we, you know, we've been planning for this since January. Just to give you an idea, we literally started this, you know, President Carter started on January 1st. Our first meeting at UNO and UNMC to do pandemic planning was January 10th. And so these types of plans are not developed or implemented overnight, because there are thousands of people, tens of thousands of students. But I will tell you, the affirmation that we get from students and family, the most of the calls I get and the emails and the texts are, is my student going to be safe? Am I going to be safe? And I get the same calls from faculty and staff. And just the simple question about dealing with vulnerability is a critical question, because there are many, many people that are not going to disclose what their medical or behavioral vulnerabilities may be. And you need a very careful way to think that through as you make the decisions as to whether it's an on-campus or off-campus experience for them.
I want to just add a little bit to this to kind of give some context for everyone. You know, if you were to take a look at the top 4,000 undergraduate programs for college and university across the country, about 80% have made some declarative statement that they are planning or will be open in the fall. I think all of us in this listening audience might be shocked to know how many are using Jeffrey Gold and the Global Center for Health Security's checklist. I was on a Zoom call yesterday with the Dean of Harvard Business School. They're using it. MIT is using it. A number of the Ivies have been in touch, and they're not doing anything that much different than what we're proposing, which is really something of a blend. Not everything will actually be in person. There will be some that will be better suited for remote, and in the interest of what is smart and best, we'll still be doing that. And of course, if there is, and I know a lot of people saying, what happens when there's a spike or there's a rise. That PRAMS data will give us very near term, almost real time information so that we won't be in the same place that we were in March, where we were kind of guessing as to what was happening. We will have real time information on the ground, and we'll be able to react quickly should we by location. So there's a lot that's going into this. I think you just got a thumbnail of how deep the work is that Dr. Gold and his team have done.
Thank you. You know, one of the things that we're thinking about is it sounds like there's an appetite for folks here and others, actually in the 3 other regional compacts that cut across the country. So we may have some additional webinars or Zoom type webinars until we're able to be in person to share some of these best practices and ideas. So we'll follow up on that. But Senator Francisco from Kansas, she's one of our commissioners. She has a question about changes in course offerings. A number of ideas have been cited by you and by some others, you know, establishing shorter terms, so quarters rather than semesters, or even shorter terms than that. Having folks meet in smaller groups, meet in, you know, start in person in August and finish earlier, for example, by Thanksgiving, and not go back. Can either of you or both of you talk a little bit, I know we just have a couple minutes left, but touch on what you're thinking about with respect to course offerings?
Let me hit it at a high level, then I'd like Jeff to talk a little more detail about just what he's done in Omaha and the impact that he's seen just in the summer online community and even what's going into the fall. What I would tell you is we're taking a real hard look at not just what we're offering, and what I mean by that is academically, even though we are a large research institution, even though we provide literally hundreds upon hundreds of different academic disciplines for degree, we're at that point now as we start to look at ourselves that we can't be everything for everybody. And we will be taking a close look at certain programs that are either underachieving or very small numbers. So that's one thing that we are definitely going to take a look at. We're going to take a serious look at our academic calendar. I think we're going to run this year in the fall, and then maybe even another look at what we're going to do in the spring as a pilot, and then try to get the best lessons learned out of that. There's a couple of really key things to going into 2 large semesters and 2 smaller. One is for students that want to finish earlier, reducing their student debt. The other is reducing the amount of travel that happens during a normal academic semester. So, you know, in doing this plan for this fall, we took away our fall break. Now that was only a couple of days in October. We're going to be in school on Labor Day as well. So that allowed us, you know, our requirements for contact time, contact school days within our accreditation limits to do that and be done by Thanksgiving. Now, we may explore sometime in the spring about having a longer intersessional. You know, we're talking about not actually returning back to the class until either late January or early February, and not having a spring break and being done in the normal time in early May. So that would basically start to look like a 4-semester year in which, you know, people can choose some amount online, internships, maybe overseas travel when that comes back into play. It really could be a game changer to what the academic calendar looks like. And a lot of big institutions are looking at this. We're going to be studying it more deeply before we make big decisions. And I'll let Jeff talk about some course offerings.
Yeah, so our goals on the undergraduate side here in Omaha is really to have maximum flexibility, is that we do not believe any of the predictive models for pandemic spread or regression, or, you know, you can choose any model that you want. I can guarantee you that they're all going to be wrong. So we want to be sure that at any given time in the fall and thereafter, I mean, the only thing I can promise you is we're going to be living with this virus and subsequent viruses for a very, very long time. So whether it's going to ebb and flow on an annual basis or a seasonal basis, we don't know. We don't know whether we're going to have to go to a completely remote model halfway through the fall. So we've created multiple different options, you know, sort of a plan A, a plan B, a plan C to move forward. As President Carter said, we have shortened the length of the fall semester to try to get all on-campus activities completed by the Thanksgiving holidays. We've taken out the fall break. I will tell you on the summer session, and UNO offers a very large summer session enrollment. We're up 11% this year in semester credit hour generation. And that has just been by adding course material that frankly was just not available historically in the summer session. And I can tell you that our faculty and the staff that's worked so hard together in planning this has been just absolutely remarkable in the cooperation and the collegial and the can-do, you know, Nebraska nice approach to this. It's been really remarkable. But, you know, again, they all say the same thing. You do your part, Jeff, to try to keep me safe. I'll do my part and make the university successful. And, you know, that's the deal.
Thank you both. We are a couple minutes over, but that's a good thing. And I think everyone here has really benefited from your perspectives. We're deeply, deeply grateful to you. You know, we're here, right? We could wish that we weren't here, but this is where we are. And as you're pointing out, Dr. Gold, we may be in a place like this for some time. And I think, as you've pointed out, President Carter, that this is a deep challenge, but also provides us with some opportunities for how to think about the future. I do want to remind everybody that this is recorded. We'll provide the information on our website at 10 o'clock. For those of you that are on our executive committee meeting, there'll be a separate Zoom. So take a break, do your thing, and then we'll reconvene again at 10 o'clock for our executive committee meeting. With that, I just want to express our deep gratitude and thanks to President Carter, to Chancellor Dr. Gold, and to Provost Fritz today for sharing your experiences and thoughts and wisdom with us as we try to navigate these uncharted waters. So thank you very, very much. Should we clap?
Thank you, Susan.
All right. If there are follow-up questions, please send them our way, because we may actually end up providing, having a follow-up sort of presentation, and we might be able to kind of take the next step on this. But with that, we're going to sign off. Thanks again, everybody, as we learn how to convene remotely. It's always, it's never boring. It's always a learning experience. So with that, I'm going to sign off, express my gratitude to everyone, and see a few of you, some of you back here at 10 o'clock Central. Thanks.